Hi guys, it's the 31st of January 2020. It's 20 past 7 p.m. here in the UK. I'm just going to do an update on what's going on in the UK because we've got a bit more detail now. It was, as I suspected, the Chinese fella and his companion that were staying in the Stay City Hotel in York. I'll just read what the BBC is saying. Coronavirus, 2 cases confirmed in the UK, and this is from 2 hours ago. The BBC is the source. 2 people from the same family have tested positive for coronavirus in the UK, the Chief Medical Officer for England has announced. There were guests at the Stay City Hotel in York, before being taken to the Royal Victoria Infirmary in Newcastle. The hotel remains open for business, but their apartment will be thoroughly disinfected, the company said. A flight carrying 83 Britons from Wuhan in China has landed in the UK. They are all being taken to a hospital in Wirral and quarantined for 14 days. The new coronavirus has caused deaths of 213 people so far, all in China. Cases of the virus have reached nearly 10,000 in China, and more than 100 cases have been reported in 22 other countries now. That was only 19 this morning, so there's another 3 countries added to the list. So what is to watch out for? Coronavirus. How worried should we be? Coronavirus declared global health emergency. Coronavirus, what it does to the body. Professor Chris Whitty, Chief Medical Officer for England, said the NHS was extremely well prepared for managing infections and was quickly trying to identify any close contacts the 2 patients had to prevent further spread. But he said the confirmed cases could not be identified because of patient confidentiality. Who qualifies as a close contact? Anyone who was within 2 meters of the infected person for 15 minutes. Would the virus survive on a tissue? Probably for 15 minutes, but it was unlikely to survive on surfaces like door handles for more than 24 hours. Well, I won't believe that, guys. From what I've read and seen, up to 7 weeks it can stay alive in the carpet. It's got a special kind of protection around it, this virus. It's not like any others. 2 people with the coronavirus were moved from their York apartment hotel to be treated initially at Castle Hospital in Hull, before being taken to the infection diseases unit in Newcastle. Public Health England said there was minimal risk of infection to either guests or staff at the Stay City property in York. Those identified as close contacts will be given health advice about the symptoms and an emergency number in case they became unwell, but it wouldn't be quarantined, Public Health England said. High chance of getting better. Professor Whitty said the specialist unit at Newcastle Hospital was experienced in treating people with infectious diseases, and there was a high chance people would get better based on current information. Yeah, well, that information's wrong, bro. A lot of people will end up with a relatively minor disease, he said. A small number who go on to be more seriously ill tend to develop respiratory problems, which will be dealt with as anyone else with a respiratory disease, Professor Whitty added. And as again, guys, from the research I've done, it kills you with ARDS, acute respiratory distress syndrome. That's what kills you. Some GPs have started sending text messages to patients telling them to stay away from their local surgery and phone them instead if they feel unwell and have been to China in the last 2 weeks. And again, it's already spreading person to person, it's airborne. Don't be fooled by this media, guys. Ian Jones, Professor of Virology at the University of Reading, said the possibility of further spread was minimal because the cases were caught very early. Virus experts said they were not surprised to see cases in the UK, but there was no reason to panic. There is still primarily a Chinese emergency, as 99% of the cases have been found in China, and all the deaths have been in China, said Professor Devi Sridhar from the University of Edinburgh. And here's a map showing all the cases. 14 in Japan now, Thailand 14, Singapore 13, Australia 9, Taiwan 9, Malaysia 8, South Korea 7, France 6, US 6, Germany 5, Vietnam 5, United Emirates 4, Canada 3, Italy 2, Russia 2, UK 2, Cambodia 1, Finland 1, India 1, Nepal 1, Philippines 1, and Sri Lanka 1. Yeah, it's growing and growing and growing, man. The WHO declared the outbreak a global emergency on Thursday. The number of coronavirus cases worldwide has now surpassed that of the SARS epidemic, which spread to more than 24 countries in 2003. The mortality rate of the new strain of coronavirus is currently low at 2%, less than SARS at 10%, and Ebola at 70%, the chief medical officer says. But the death rate could yet go up if more of those in hospital die, or down if it's discovered there are many people with mild symptoms. Fly in Britain's home. A flight bringing 83 Britons and 27 foreign nationals from China to the UK has landed at Brize Norton, RAF Brize Norton in Oxfordshire. Global coronavirus cases surpass SARS epidemic. Can people recover? And other questions. Coronavirus. Why are we catching more diseases from animals? Oh no, here we go. The chief medical officer said they will be isolated from the general public, but not in solitary confinement. We intend them to be housed in a way which is pleasant, he added. Professor Whitty said he hoped they will be able to be released after 14 days without any symptoms at all, but those who did develop symptoms will be treated by the NHS in a way that's safe for them and safe for staff and the public. Right guys, I just wanted to give you that update. I apologise about my pronunciation. I can barely speak because I'm full of cold as well. Can't be ringing doctors in the morning. Right guys, God bless. Just keep your eyes open. It's crazy. There's not a lot else I can say.